Good morning, everyone, and welcome to this Dignity Firm webinar on the conditions of migrant workers in the European food supply chain industries and specifically a public health perspective. We welcome you to this webinar. The webinar will be recorded, meaning that we can share it later on for a wider public, although we are very happy to have you here right now. You're free to turn on your camera, but indeed that does mean that you're visible later on. So if you prefer not to, then it's just us who have their cameras on. I'm honored to have with me partner in the Dignity Firm project, Nora Gottlieb, who is a senior researcher at Bielefeld School of Public Health and who's our lead partner in the project on the topic of public health. So really looking forward to hear the findings from Nora from the Dignity Firm project. And then we have with us Annick Staan, Senior Research Project Manager, Prevention and Research Unit of the European Agency for Safety and Health at Work. Welcome, Annick. Good to have you. And we have Wiebke Warneck with us, who is with EFAT. That is the Union for Food, Drink and Tobacco Sector, and the wider union, of course. The program is as follows. Each of the speakers presents, and then we have room for Q&A. We agreed that if there is a question for clarification, that can come right after the presentation. You can use the raise your hand button, or you can use the Q&A button available to raise such a question. You can also use the Q&A button for a more in-depth question, for which we will then come back to you during the Q&A. Do keep the questions to the point, though, because reading and talking at the same time is always difficult. But happy to see so many of you join us in this discussion on, again, the conditions of migrant workers in Europe's food supply chain industries, a public health perspective from the Dignity Firm project. Finally, before I go to Nora, my name is Tesseltje de Lange. I'm the principal investigator together with Pascal Beckers in this project. And the project is actually coming to its close. That's also why Nora has so much to tell us. In March of this year, no, not this year, next year, of course, 26, we will have our final event. And if you want to know more about that, you can follow us online and through LinkedIn to learn about that and potentially join us. Okay, without further ado, Nora, can I hand over to you?
Yes, of course. Thank you very much. And yeah, so I'm going to share my presentation. Oops, we are in the wrong slide. 1 second. Now. Okay, so I can now see my presentation. I cannot see you, which is always a bit irritating, but nonetheless, I'm going to dive right into it. This is what you're going to hear from me in the next 10 minutes. I'm trying to really keep this very short. I'm just going to say what role the topic of worker health actually played within the Dignity Firm project, and then share a couple of insights and lessons learned, really more from a bird's eye perspective. I won't have time to go into much detail. But of course, you're always welcome to contact me even after the webinar if you have further questions. Okay, very importantly, the Dignity Firm project focused on the topic of workers' conditions. It wasn't a project about worker safety and health. It wasn't a public health project, but it addressed worker conditions. Now, for me as a public health person, as the public health person in the project, what my colleagues call worker conditions, I call social determinants of health. The social determinants of health is kind of classic concept in public health, which basically says that the conditions under which people are born and learn and play and work and age, et cetera, that these conditions centrally shape their health. And so whether my colleagues, so the project kind of approached worker health and well-being from this broader holistic perspective, right? So whether my colleagues researched working conditions or housing conditions or access to social rights, or let's say insecurities related to legal status. So this for me are all health relevant factors. These are all factors that shape people's health and vice versa, where health also sometimes shapes these conditions. Now, on top of this rather broader perspective, I also did a more specific literature review where we collected the existing evidence on what we know about links between migration and precarious work and health. You can access this under the QR code at the bottom. And we have one case study that focused a bit more on worker safety and health, which was my case study, where I looked at the meat industry in Germany. So what I'm going to share with you in the next few minutes is kind of based on these project components. Okay, my first insight from this project was that there is a huge knowledge gap on migration, work, and health. Of course, there's a ton of literature on migration and health. There's a ton of literature on work and health, and there's very little literature that brings together all three. Another insight and challenge is that it's really hard to come by decent data. In very many cases, data is just not existent because migrant populations, and especially, of course, migrants in irregular situations, are just not included in data collection, especially in routine. So, for instance, in another EU project, the Safe Habitus project, for instance, looked at statistics in the EU on accident rates among farm workers, and they found that in most contexts, seasonal workers are excluded, which of course leads to a massive underestimation of accident rates if you exclude this huge group of workers. Even when data exists, it's often not accessible, sometimes because institutions don't want to share it or for various reasons. So data is really a big problem. Despite these limitations, there are a couple of things that we can say based on the literature, but also based on the Dignity Firm research. And one important insight is, I think, that migration and legal status are really like upstream factors that compound workers' precarity. And what I mean here is that in most cases, I would say being a migrant or having a precarious legal status is not a direct health risk. Like, people are not at higher risk to contract a disease or to have an injury, an accident, because they've crossed the border, right? Or because they hold a different passport. But these are factors that make a big contribution to workers' precarity and to workers' exploitability. And it's the precarity and the exploitability that put workers at a higher risk. Not only, but these are, they make a huge contribution to the workers' work-related risks. And then another important insight is, of course, that formal rights are not the same as de facto rights. I think in the EU, we sometimes have wonderful laws and wonderful regulations, but because of the migrant workers' precarity, they're just not able to access or to realize the rights that they have on paper. All right, now, just it's important to remember that, like, providing migrants and migrant workers with equitable access to protections and to work rights is not something that EU states are doing out of goodwill. It's not a charity, but it's EU states are actually committed to this. They are legal commitments, and you can find these enshrined in various bodies of international law and conventions, some of which are listed on the left side. And yeah, again, like my colleagues from the Dignity Firm project have done a wonderful job in summarizing, for instance, the relevant EU legislation, and you can find an quite yeah, comprehensive working paper under the QR code at the bottom. Now, part of the research that was done within Dignity Firm kind of seems to indicate that little development in a positive direction, to be honest. So I'm thinking, for instance, at research that one of our colleagues did in Spain in the area of Almeria, which is called the Plastic Sea. You can see it here on the screen. There are lots and lots of greenhouses. It's an area with lots of greenhouses in the south of Spain. You can see it from space in that in the picture on the top right. Here,
We lost Nora.
Sorry?
We lost you for a second, but you're back.
Ah, sorry. Okay. So my colleague, when she talks about this case, she often starts by saying that what got her interested in this case study was that the workers' dire conditions had been in the headlines around 2000, right? So more 25 years ago. And since then, nothing has changed. And she was, as a researcher, she was wondering how this is possible. Now, when I talk about the meat industry, I often start by showing this book, which is a publication from 1906, like beginning of the 20th century, and which describes the terrible conditions of migrant workers in the US, in the US-based meat industry at that time. And of course, I don't want to say that nothing has changed, but I do want to say that on a very, very principal level, I would say that the patterns of workers' precarity and of yeah, industry, like exploiting this precarity on a very principal level, the patterns didn't change. And then finally, and one last example, our colleagues looked at the situation of agricultural workers in Italy, and here too, various efforts have been made to improve their situation, but on the ground, the literature kind of indicates that not much change has happened. So yeah, so this is a bit of a grim insight maybe from the project, but we also do have a couple of positive examples. And one example I want to show here is from the area of platform work. For instance, our colleagues looked at the example of Spain. They did look at the Spanish riders law, which was a law that, in order to improve the work, to strengthen the workers' rights, introduced the presumption of employment and algorithmic transparency. Now, this law is actually not the positive example I want to talk about because for various reasons, it did not reach its potential. It did not play out as impactful, as positive as it was expected. But what our colleagues did also find was that rider-led alternatives emerged, and these rider-led models of delivery platforms or cooperatives really succeeded to do things differently and to improve the workers' conditions and also to improve the workers' occupational safety and health. And I think these are really, really interesting examples, and I want to encourage you to read the publications, which you can find under the QR codes at the bottom. One last positive example stems from the German meat industry. So here I looked into a legal change from 2020, 21. So here, after COVID outbreaks in the meat industry, the federal government took a quite drastic step and just in a top-down measure banned subcontracting and temp work in the core area of the meat industry starting from 2021. And so the law resulted in a couple of improvements, primarily that workers had to be directly hired, also improvements in terms of more accurate work hours and salaries. There's evidence that occupational safety and health improved. So this was a very, very positive step, maybe similar to the Spanish riders law here too. For various reasons, maybe the law did not reach its full potential, but I would still highlight it as I said, as a very, very positive step and kind of good example. So overall, I think what we can learn from these positive examples is, first of all, that change is possible, given that there is political will. On the other hand, what we can also see is that migrant labor regimes in the different contexts, in the different industries, are like these really economically, socially, and politically embedded systems, and many stakeholders profit from the workers' situation. And so these like embedded systems are really, really hard to tackle or to overcome because you have lots of stakeholders with an interest and also with lots of powers to maintain a status quo. So this makes it hard to achieve like comprehensive change. So alongside laws, real change needs very strong enforcement. I would say it also needs the migrant workers. You need to get them on board and consider their priorities and interests. And what we can learn from the Spanish case maybe also is that if you can develop alternatives that are locally embedded and that offer various local stakeholders like a win-win situation, that significantly increases your chances of success. And another thing that we can learn from the Spanish case is that these rider-led alternatives are real alternatives in the sense that they didn't just copy the model of the big platforms and then try to tinker around and improve things a little bit, but they really do things differently. Like it's really a transformation in the sense that they think of how businesses can work in a different way, and it's really a transformation in a sense of social and environmental sustainability. So I think we may need more this kind of transformation rather than reform. And that's it from my side.
Thank you very much, Nora, for flagging these examples that we came across and analyzing them from a public health perspective. I said at the beginning that if there are questions for clarification, we could take them in between the presentations. Otherwise, I suggest we go straight to Aniek's presentation. As I said, Aniek is with the EU OSHA, working in the Prevention and Research Unit for quite some time already, and coordinating the work on anticipating change and future of work projects. So that really nicely ties into Nora's call and suggestions for ways forward. Without further ado, Aniek, can I hand over to you? I don't see any clarification questions posed. If you can share your slides, then we can go straight into your presentation.
Yes, thank you. Yes, I hope you can hear me well. Thank you for inviting me for this interesting topic. Yes, you noticed, I hope I can share my presentation well. That should be this one. And I think you can see it, but the problem is, can I move the slides?
We can see it. And
and I can
you can move the slides.
What a day.
Perfect.
Yes.
Go ahead.
Still? Oh, no. I know what I did wrong. I should put it here. So, yes, welcome. So my name is Annick Starre. I work for the European Agency for Safety and Health. And for those who don't know, I have actually no idea. We are based in Bilbao in Spain, and we are committed to make Europe a safer, healthier, and more productive place to work by promoting a culture of risk prevention. So yeah, we are there to improve working conditions. But I have to say, we are especially there to share information, to collect information from all the member states, from governance workers and employers, and to disseminate, for example, good practices and information. So we're not there to make legislation or inspection or enforce the law. So just to make that clear. We do quite some different activities. As I said, we do sharing of facts and figures. We do raising awareness with our campaigns, quite huge campaigns. We do networking. We provide tools, so as for example the OIRA risk assessment tool, and we do anticipating change, and that's what I'm in the lead for. And I think this is interesting to mention, because if it's about migrants, it's always like a cross-cutting team. So we don't have any project specific that I was looking for now again. We don't have specific projects on the topic. So it's all like in between all of our projects and activities. We have always this cross-cutting teams. Does it work for SMEs, for small companies? And does it work for vulnerable groups? So, and what you see here is just overview of the campaigns that we had in the last year, some examples. And our last campaign that was actually finalized last week was on digitalization. So throughout all these projects, we have information on specific migrants, like facts and initiatives. And for example, we had this future project on occupational safety and health in agriculture. You can imagine why. There are many registers there. There's a lot of underreporting. And just for your information, maybe it's good to know that together with DG Employment, we have already years ago published this overview. Yeah, I have a lot of slides, but I want to go through it quickly because you can look it up later. So in this report, you see the killers in agriculture. You see the health challenges like chronic diseases, like pesticide-related or musculoskeletal, and stress, not to forget. And what we mention here, that when we come to the recommendations, especially when you look for future challenges that are coming, new digitalization related to the climate change, there needs a lot to be done. But especially we mention here that had the undeclared work, and ensure that adequate protection needs to be there for the seasonal and migrant workers in the sector. So in this way, it comes back, and as one of the conclusions, we said that the EU Farm to Fork strategy, this has recognized the importance of the EU pillar of social rights and its application to the sector. However, there are still so many issues, and with the marginal profitability and income, especially for the small farmers, it will be very difficult to really act, especially what I just mentioned with the growing trends such as digitalization, climate change, society pressure, and labor market development. Especially for these vulnerable group, it's very important to be aware of the poor level of OSH protection that they have. So then I start with the focus on the intercultural diversity and the migration. Well, just very general. There's a lot of cultural diversity here. Often it's people who seek for employment, and based on the last figures, it's likely that this will be maintained. And also we have a very long history in Europe, especially some countries, with taking in the migrants. Where do we see them? Based on our figures, based on our work, you see them in manufacturing, mining, energy construction, wholesale, retail trade, hotels, restaurants, and health and social work. And often these are occupied in the low paid and unskilled and hazardous jobs, the so-called 3D jobs. And for the effects of migration, mostly we say, well, they are positive ones. It's a trigger for learning, for cooperation. It's a moral and ethical good. But also there are, especially for OSH, there are some negative aspects, which has to do with the language comprehension, the risk perception that can be different, values about work and the background, education, culture, and also the characteristics of the job. So it's not it's the jobs that they are in and the related working conditions to their jobs that are dangerous. So yeah, that is. So we have some figures also from our surveys, and there's extensive evidence showing that migrant workers are more exposed to physical, psychosocial, and organizational risk factors in the workplace than the native workers. So, for example, our European working conditions survey data, you see that have 40% of first-generation migrant workers carry are moving heavy loads more than the native workers, or they work in tiring or painful positions. Also, we see that migrant workers are more exposed to risks such as vibration, environmental hazards such as toxins, extreme temperatures, pesticides and chemical, as well as accidents at work. And also we see from several studies that there are a range of physical and psychiatric comorbidities with which workplace accidents and musculoskeletal diseases injuries are associated. So these are also often associated with other psychosocial elements such as depression and stress. And so if we look at the psychosocial risk factors that may contribute to this higher prevalence of occupational safety and health related problems among migrants, well, you see here a list that you will recognize that often temporary work, long working hours, lower salaries, bullying, harassment, and discrimination at work. This is one coming back like really strong. Feelings of isolation, being in a strange country and being alone, and then the limited training and the lack of involvement, especially in the OSH-related aspects of the workplaces, lower bargaining power, the limited knowledge of host countries' language and culture, discrimination, and then next to that also the limited access to housing and health services. And then if we look at illness, then of more like health problems, we see that migrant workers also report poor health outcomes, including infectious and metabolic cardiovascular diseases and mental health issues, as well as more accidents at work, and also higher prevalence of musculoskeletal diseases. And also, there's something that we've seen, that's the healthy migrant effect. That's when people in the beginning seem to be, young workers seem to be okay, but then there tends to be this change really rapidly over the years that has which deteriorates their health. So when we go about how do you manage those OSH aspects in multicultural work teams just at the work floor? Because we already were talking about the more like broad EU frameworks. Here, I would like to focus as well, as we've seen in earlier studies that we did. Like, how can you create like more awareness of the intercultural factors that are on the floor and working in teams when you are working with migrants together on the work floor. And there are quite some theories, for example, Hofstede, that gives some support, but we also see that that's a danger of overrating these differences, and that it leads to stereotyping. For example, in the work design, I think you know this kind of theories. You have these more, for example, these more collectivists versus the more individual cultures, which says something about the way that you give your direction, as the way that you have your leadership and more participative leadership or not, how people feel well with their personal autonomy, how important it is for them. For example, the need for social support. These are all kind of aspects that differ from culture to culture, that especially in leadership, but also in interpersonal collaboration, can be taken into account to lead to better working together on the floor. And also, I mean, on the work floor, that is also where it has to start like bottom up, to be combined with the more top down initiatives that are coming from the EU floor, maybe from the legislative aspect. So from these kind of studies, some recommendations that we have been given is like address these language barriers, because they are very, very important for health and safety, that people really understand what are the safety issues. For example, this can be done with pictograms. Also, the cross-cultural leadership is very important to understand well, to avoid any misunderstandings and conflicts. And training of competences that increase intercultural awareness and effectiveness is important, and also related to the national regulations and the educational systems that are behind, and stimulate an inclusive working environment with respect. So before I get to my last slide, I would like to mention the competence for intercultural effectiveness. That's this cultural empathy, this ability to empathize with the feelings, thoughts, and behaviors of the different group, to try and to keep and stay open-minded, to show the social initiative when things are not clear, to take the initiative in a proactive way. Emotional stability is important. Things get a bit stressed and don't work out the way you expected it to be, and flexibility. And these traits are on the work floor really important for effective coping with all these kind of intercultural situations that can happen. Even more important than the general inclusive culture that is on the work floor. So interesting is also that we have a new campaign coming up, and that's the campaign on mental health. And also here the aspect of migrant workers is one of the cross-cutting themes. Diversity is important when we look at mental health at the work floor. And we have a draft publication. It's not there yet, so I cannot show too much of it. It will be published in Q1. But related to the topic of migrant workers, we have a summary of psychosocial risk factors. And it's, for example, related to discrimination and inequality. The risk factor is visa precarity, exploitation, language barriers, fear of reporting, and intersectionality. And we see some examples of prevention measures. I think very important that came back. Ethical recruitment is important. Multilingual information, and for example, combined with visual information, cultural competence training, and related to the work conditions, undeclared work, platform work, very low pay, fragmented hours, you know them. Also here we have a list of prevention measures. The same for work organization, isolation, long hours, low autonomy. You see as a prevention measures the participatory risk assessment, safe scheduling of work, etc. And the last, violence and harassments, that came back for all the diversity groups. Also here we have the third-party violence aspect mentioned, and also as a prevention management, we aim for protocols and more targeted inspection and union support for migrant workers. So time is running. As a last slide, I would like to show this diversity-sensitive risk assessment, because risk assessment is really like the basis of our legislation in the Framework Directive for Health and Safety. And risk assessment is to make clear and transparent the risk in general for the average workers. But here with this diversity-sensitive risk assessment, there's more focus on the specific needs for all workers. So it's very important that the diversity issues in risk assessments with this method, this approach can be better taken into account. And we have some information on our website on this when you would like to need more. And maybe in the last presentation, I understood this aspect could come back. But yeah, since risk assessment is one of the basic for good ocean management, to make clear what are the risks and what can be done about it, this diversity sensitive risk assessment is, I think, really good to mention at the end here. Okay, so there is a lot, yeah, in all our projects to mention about the approach on migrants. But for now, I hope we have some aspects covered. If you want to have more information on our work, I provide you with some links here. And even if you want to read more, we have some resources, but we will give that later to you. I think that the slides will be shared.
Yes,
okay, so thank you.
Thank you very much, Annick, and also for this literature list at the end that I think participants will indeed be very happy to consult. And just very briefly flagging something that stood out to me, your mention of extreme temperatures. We had a project visit to Agadir, and indeed there you also have agricultural workers under the plastic, and temperatures going up to 40 degrees, etc. And that was indeed one of our worries of these extreme temperatures that people have to work under. And I love how at the end of your presentation you mentioned that the involvement of the unions is key to improve, to monitor, to improve working conditions. So
yes,
without
and
further
maybe
ado,
one, yeah, so
yeah?
not unions talking over them, but like really involvement within the
Yeah.
unions. Yes.
Yeah. Yeah, I hear you loud and clear. For us, from the Dutch perspective, as I'm situated in Nijmegen, that is indeed a point of worry, because membership of a union does not automatically give access to all the services. You sometimes have to be a member for 6 months before you get at least legal assistance. So I'm and I think at the central level there's always a push for inclusion of migrants, while at the local level there might be some hesitation there. Let's put it like that. But I think our next speaker, Wiebke Warneck, can tell us more about it. From the European Trade Union Federation for Food, Agricultural and Tourism. That's the overall title. And then you're working on food, drink and tobacco, which has not been abolished yet. And of course, food is where we meet each other in our interests. Wiebke, the floor is yours. Sharing the presentation again.
I will. Okay, thank you very much. Good morning, everybody. Yeah, effectively, food, drink, and tobacco, because there are workers in tobacco as well. So that's why. Okay, so yes, effort. You explained who we are. We are actually regrouping 121 national trade union organizations from 40 European countries. And as you said, we defend, and I hope you can see my slide. We defend mainly workers in the sector of agriculture, tourism, domestic work, and food industry. If you look at that list, you already you can already imagine that it is actually mostly workers with a very high precarity, and as well actually sectors with a very high percentage of migrant work or migrant workers. So that's, I think, why we fit quite well into this morning's discussion. And well, I wanted to bring a bit of concrete examples to you. So if we start with agriculture, well, you might know that we have around 10 million workers in agriculture in Europe. And of course, nowadays we often speak about the farmers. We speak much less about the workers on the farm. So that is really what we try to push. And you have already mentioned it. In agriculture, of course, we have a lot of seasonal workers, what is a big issue, but as well other precarious status. But maybe you have been given the example of Spain. Maybe we can highlight the example of Italy as well. You might have heard about a region which is called Borgo Mezzanone. It's next to Foggia in Puglia in Italy, and is actually one of the biggest shanty towns we have in Europe. So during summer, you might find around 6,000 to 7,000 migrant workers living there in really awful conditions. So they have no access to running water, for example. The waste is not collected, and they take whatever they find in order to put a roof over their heads. So before summer, we as EFFORT, for example, brought European policymakers to this shanty town in order to really concretely attract their attention to this. And I think that's, of course, today we speak more, let's say, about the working conditions and the and health and safety aspects. But of course, we cannot neglect the migration policy on European level with regard to these workers. If we look into domestic work, there as well, we have around 10 million workers there. And one of our main demands here, well, we call it the house of dignity for these people, but is, for example, as well to include them in the scope of the health and safety framework directive, because, well, it might be strange, but they are for the moment not covered, and that is one of our big demands. You talked about as well, Annick, about future challenges. So of course, climate change and the global warming is one of the big areas we go into because it has, of course, direct consequences on the workers in our sectors, let's say mainly in agriculture and tourism, but not only. So they face, of course, increased risks and disruptions of their work due to the heat, which have direct impact on their health and safety. So one of our demands here is, for example, a directive on maximum working temperatures in Europe, which we believe we would really need. And that brings us to the
Wiebke,
next.
Can I?
Yes.
Are you shifting your slides because
Well,
actually, oh, you are now. Yeah,
exactly.
Yes.
I'm finally
okay.
there on the next
Perfect.
one. You see?
No, perfect. Yeah.
And that
Sorry for interrupting.
That was the food industry, effectively, which was the last sector left, let's say. And I just wanted to make the link with what Nora said on meat. We have actually really had a focus over 2 years on the workers in the meat industry. Because if you look at food production, it is still one of the most difficult sectors we can find. You have extremely precarious jobs. You have low wages. The working conditions are extremely difficult, very long working hours, but as well, well, if you look at health and safety, it is of course a cold, a slippery environment. They need to use dangerous tools. It is very repetitive movements they have to make. So we have there as well a very high turnover, which is of course as well an issue, let's say, from the trade union perspective. Very difficult actually to get in contact with the colleagues in such workplaces. And I think what I really wanted to really put out here is effectively the language barrier. I think that is one of the biggest points, of course, in the work with the migrant workforce. And if you look at meat, our colleagues tell us, so we can be around even 80% of migrant workforce in slaughterhouses. So it is really huge, and maybe there as well in the let's say, if we have a look at the real world, what you would find in a slaughterhouse nowadays with regard to whatever processes, but as well health and safety, is you will find them in the language of the country. You will find them in English, but you find them everywhere now as well with regard of the most spoken languages of the workforce. And of course, as well from the trade union perspective, what really changed was that trade unions now speak as well the languages, other languages where they know they are important for the sector. So if I say they speak these languages, it is really as well that there are hotlines, helplines, etc., taking their cases. You know the example certainly from Germany, Faire Mobilität, which is helping these workers in order to get their rights. What I wanted to share quickly this morning is that if we look at all these sectors, we developed it from the meat sector, but we see it throughout our sectors everywhere, unfortunately, is that if we look at the mobile workforce, but not only, we find actually different patterns of exploitations in the sectors. But we have really the impression that we can burn it down to labor intermediaries and subcontracting as exploitative models. They work differently in different countries, but we thought that if we would regulate on those issues, we would actually get rid of a big amount of abuses and exploitation in our sectors. So, as I said, we see exploitative subcontracting and really unregulated labor intermediaries really dominant in our sectors. And if it is an intermediary bringing colleagues from the CE countries into other countries, if it is third country nationals, but it's is specifically harmful really to mobile and migrant workers. And I think what we have heard already today as well is our third pillar, the lack of inspections and oversight. And you have already mentioned it. And we really see that as one of the big problems as well, which favors then the erosion of labor rights and collective bargaining, and actually unfair competition. So what we try to do is we say, well, we need to come back to equal treatment in Europe, and we believe we can get there through what we have proposed. We proposed a model directive on subcontracting and labor intermediaries to the European policymakers, and I already quickly talked about the three pillars we have there. So we want to ensure equal treatment across subcontracting chains. We really think that we need to tackle gangmaster practices and the role of labor intermediaries in Europe, because if you look across the different countries, actually labor intermediaries, and here I'm not referring to temporary agencies, are not regulated. So we think there is really something to do. We want to see a license, for example, a register, in order to ensure transparency. On subcontracting, we think that we would need a ban on core subcontracting for core activities. If it is with regard to specialized jobs, that's not an issue, but core activities need to be done by directly employed workers. We would need some rules on joint and several liability, and we think we need to cut the long chains and get back to, well, a maximum of 2 tiers. And then, as I said, we need to have more effective and frequent labor inspections. So I'm not going to go into detail on all that. Here, I wanted just to come back to the migrant workforce, because for us, it is, of course, very important that a worker is a worker, regardless of the status. That's as well what we try to do with that directive. And what you would find in there, if you will have a look at it, is that of course we have something on housing in there. The fact that it cannot be linked to the work contract, because then people are even more vulnerable. If they lose their job, they lose as well their homes. So we need to do something about that. But we think that we need as well a firewall between actually labor inspection and the migration authorities, because if not, we cannot improve the working conditions for the migrant workers if they fear then to be deported. And now I don't know how to move to the next slide. That's a problem. Can you see it? Yes. Maybe not here. Yeah, now. I just quickly and then I will finish. Wanted to share with you what is going on now on European level from the policy perspective. So you might wish to have a look into the own initiative report of the European Parliament, because there is one on abusive subcontracting and unregulated labor intermediation. It was voted on the 3rd of December in the Employment Committee. It will go to plenary on 20th of January. Interesting, of course, certainly for you as well, is to have a look at what the European Commission just came out with on the 4th of December. So they published the Quality Jobs Roadmap. That's a bit of a very broad package. There it is all kind of measures, actions, etc. Those ones are not binding. The idea of the binding ones, you will find them in the Quality Jobs Act. It covers 4 areas, and here we will find subcontracting as well and labor intermediation. This is now under the process of social partner consultation on European level, and the mobility package is going to come in spring next year by the Commission. I have as well put some further reading for you, and well, if you wish later on, you can have a look at our film, which is called "It's Time to End Abuse." Thank you very much.
Thank you very much, Wiebke, and also for the additional information, which indeed we plan to share. We have a couple of minutes left for some questions. So I open up the floor. You can either raise your hand and say the question or use the chat if you like. Nora, you want to come back, of course. Go ahead.
Yes, I have 2 questions, one for each of my co-presenters. Annick, I found that risk assessment really interesting. I was just worrying if it also includes an assessment of whether workers feel able to avoid or mitigate risks even when they perceive them, or if there's assessment of, pressures or trade-offs to prioritize, let's, for instance, speed over safety, these kind of things. Because even if I perceive a risk, if I'm aware of a risk, maybe sometimes I'm in a situation, not in a situation to address it, right? Maybe workers are not always able to do that. So that was one question. And then a question to Wiebke. It seemed to me from all of our presentations that agriculture is a problematic sector. It kind of seems resistant to change. And then you also said that the meat industry is a particularly difficult sector. So I was just wondering, what makes some sectors particularly problematic?
Thank you. Let's take this round first, so that we're sure you're getting your answers. Annick.
Yes, thank you for your question. Yes, I think these perceptions of issues should indeed be there, and that the involvement of the workers and the participation of being involved already in the risk assessment and to be able to mention the issues is very important, but also to, for example, to share and then tell what aspects are difficult for them to kind of speak up. So I think these issues are indeed very important to include in the risk assessment. It's not only the formal objective risk. It's all included. Yeah. That was my question. No, yeah.
Yeah. Thank you, Wiebke.
Thank you. Yeah, a very nice, very nice question. I think a very large, question as well. Maybe what makes some sectors particularly problematic, I would say, is probably often the price pressure we have on these products. But then I think as well a bit even. I wouldn't call it traditions, but even the setup of certain sectors in certain countries. Because what actually, if we take meat, I mean, what happened is the meat sector wasn't a disaster in all countries, for example. So we have as well good examples. In Denmark, for example, it's a sector which is covered by collective bargaining. The trade unions are in the companies. Things are in principle going quite well. So in that sense, it is often as well sectors where the companies actually find loopholes, where they find possibilities to avoid their liability, because a lot of what I have set out here is about finding models to avoid their liabilities. So you presented the German example, and I think it is a very good one because there have been changes by law. So it is as well sectors. Yeah, the better ones might be sectors where we have coverage by law, where we have collective agreements, and it is of course true that we try step by step through collective bargaining in certain areas. For example, in Spain and Italy, it was the case to try to ensure positive advancement in the meat sector. Now we try to do this through law Europe-wide, but I really believe it is very often price pressure and the opportunity for companies to go into one country or the other where they can still use loopholes to avoid their liability and to produce cheaper.
Thank you, and thank you indeed for mentioning also this price pressure, right? That is out there in these sectors, and that is also something that we're looking into in like what pushes employers, and on that, potentially, Pascal, you have a question or a comment, maybe on this or maybe on something else you want to come in. Go ahead.
Yeah, it's actually triggered by a part of the presentation by Annick early on, that there's also a study now about digitalization, automation, and like changes in occupational safe and healthy issues. I was just curious because I've just completed the field work also and the report for the Netherlands on the agriculture and the gastronomy sector. So clearly the issues that have been identified here, the margins, the pressure, but also the reflectivity on technological change, automation, which in the Dutch, some of the Dutch subsectors in agriculture is really quite far advanced. But this has substantial implications also on the nature of work and also on the risk that that migrant workers are facing. But there's not so much reflectivity on the part of employers on that at the moment. We asked the question: so how is work changing? So there's a lot of vague reflectivity, but there's no reflectivity really on risk of migrant workers. Anything that you have into that direction that you could inspire us with?
Annick, just briefly, also looking at the time, we have one more question from Małgorzata. Yeah. I suggest, Małgorzata, you pose your question as short as possible, and then we go to the answers.
Okay, good morning.
You have an echo on the line, Małgorzata.
I'll put it via the chat.
Okay, then we go to Annick first, in answer to Pascal.
Yes, I've noticed by our Good Practice Award what kind of interesting digitalization there is in the Netherlands, and I think quality of work is there very, very important. It's good it's a good thing of automation that you can like automate the risky parts of the job, and that seems easy, but it's very important to take care that in the end there will be a good job left, which has like enough task variety, which has a good beginning and an end, where they don't have to do like only the repetitive parts, where they don't have to do only the complex tasks. So in the end, to have like a full job, that's very important there. And I think especially the vulnerable groups, we have to take care that they have enough competences to deal with the new digital tasks, so that there's no digital divide, that there's still equity over especially the vulnerable groups who are a bit behind in all these kind of new devices, that they are trained, etc. That's these kind of things came up in our digitalization campaign. How important it is to keep the vulnerable groups and the migrants involved.
Yeah, thank you. I'm also looking at the time, and people need to leave. Margosata has posted her question in the chat. I want to propose, sorry Margosata, that we do that in an email correspondence so that I can close this event on time. Thanking very much Nora, Aniek, and Wiebke for their presentations and their insights, and giving us plenty of things to work on in the Dignity Firm project, wrapping up the project, but also thinking on follow-up projects that come from this, and your input is also very much appreciated for that reason. I want to thank everybody present for listening in and for their kind comments in the chat. And we will keep you informed on the outputs of the project and, of course, the follow-up from this webinar. Thank you very much and have a very nice day. Goodbye.
Thank you.
Thank you.
Thank you.
Bye-bye.